Good evening, friends. So today's topic is our acupuncture for mental disorder caused by flame fire harassing the heart. Okay, mental disorder caused by flame fire harassing the heart. So let's discuss heart pattern. The flame fire harassing the heart. So what is the concept? So concept of this pattern is due to combination of heat and fire obstructing the heart orifice, so and harassing the mind, resulting in the mental disorder. So what are the clinical manifestation? So let us discuss the clinical manifestation. Flame fire harassing the heart. Let's take a help of whiteboard. Clinical manifestation. Okay, so number one is the fever and mental restlessness. Mental restlessness, reddish complexion. Okay, face will be red. Okay, reddish complexion. Red eyes, thirst, coarse breathing. So coarse breathing, it's a sound of the lung. While breathing, the lung sound will be there. Coarse breathing. Coarse breathing. Constipation. Constipation. And yellow urine. Yellow and sticky sputum. Yellow and sticky sputum. A rattling sound in the throat. Rattling sound in the throat. And insomnia. And suffocating feeling in the chest. suffocating feeling in the chest, then heart irritation, heart irritation, then even mania or delirium. So that is the what is the delirium? Delirium, it is the serious changes in the mental abilities. Delirium, delirium, and then violent or aggressive behaviors such as the tendency to hit or scold people. So he may be hit to people or बहुत गाली बकेगा वो हर एक को वो स्कॉल करेगा स्कॉल पीपल धमकी देगा बहुत बैड वर्ड बोलेगा एंड ऑल्सो डिस्ट्रॉय ऑब्जेक्ट जो हाथ में आया वो फेंक देगा डिस्ट्रॉय ऑब्जेक्ट देन इनकोहेरेंट स्पीच असंबंध बातें करेगा ओके एंड अनकंट्रोल लिपिंग एंड लाफिंग विदाउट obvious reason okay without reason वो हंसेगा हंसते रहेगा without reason and if you see the tongue will be red and yellow and grassy coating and a pulse will be slippery and rapid okay these are the clinical manifestation when the flame fire harassing the heart okay it is in the mental disorder because the mind is reside in the heart okay heart is the house of the mind so how you can analysis this pattern analysis okay this pattern mainly caused by the severe emotional irritation leading to stasis of chi okay so chi को वो stasis बनाता है क्या बनाता है इट्स द सीवियर इमोशनल इरिटेशन chi को stasis it's lead to stasis of chi which change into the fire and chi that change into the fire and fire blazing and changing the fluid into flame or by exterior pathogenic damp heat that which accumulate okay and that store inside the body that resulting in flame fire or by invasion of the exterior pathogenic heat which burn the fuel into the flame and flame fire harassing the heart okay because it is the obstruction there is the obstruction by in the heart by the flame okay and what are the main symptoms main symptoms are the mental disorder and the manifestation of the interior flame fire such as the yellow sticky sputum, red tongue and yellow greasy coating, a slippery and rapid pulse. So if you see these symptoms, so you can identify there is the flame fire harassing the heart. Again, I am repeating, mental disorders and manifestation of interior flame fire, such as the yellow sticky sputum and red tongue with a yellow greasy coating, and pulse will be slippery and rapid. So this is the combination of the symptoms. You can identify this pattern. See, when we are discussing on the flame fire harassing the heart, flame fire harassing the heart. First, it is the warm heat disease. So, warm heat disease, that is the part interior heat, steam, skin, and flesh. In warm heat disease, when interior heat steams skin and flesh, so that manifestation of the fever. So then patient will suffer with the fever. Then warm heat disease with interior heat blaze upward, go upward, interior heat go upward, that is the reddish complexion and eyes and coarse breathing. So when heat blaze upward, when heat goes upward, then face will be red complexion, and eyes will be red, and breathing will be coarse. It is the very sound making breathing, okay, coarse breathing. And next, warm heat disease with the flame fire disturb mind. Flame fire disturb mind, that is the severe change in mental condition and mania, severe change in the mental conditions and mania. Okay, and then, okay, flame fire harassing the mind with the internal production of the flame due to organ damage. There is the organ damage. Because of that organ damage, that is internal production of the flame. Okay, so then it is the profuse flame, lot of flame, profuse flame, flame fire that blocking and harassing the heart. Okay, that consequence are the heart irritation, insomnia, if mild. That is the if that profuse flame in the mind, mild. That is the heart irritation and insomnia, and other violent behaviors. Okay, profuse flame fire blocking and harassing the heart, then violent behavior, a tendency to hit or scold people, and incoherent speech, okay, and uncontrolled laughing or weeping if severe. So if that pattern is severe, so this violent behavior, tendency to hit or scold people, incoherent speech, uncontrolled laughing or weeping if severe. Okay? And then flame fire harassing the heart. Okay, then next patterns is the heart injured the fluid. Sorry, heat injured the fluid. Then there will be constipation and yellow urine, yellow and scanty urine. Okay, when heat injured the fluid, there will be constipation and yellow scanty urine. And if profuse interior flame fire, profuse interior flame fire, then yellow and sticky sputum or rattling sound in the throat. Okay, and if the flame blocking the chi dynamic, if the flame blocking the chi dynamic, then there will be chest suffocating. And last, red tongue with the yellow and grassy coating. That symptoms identify when you see the tongue will be red with the yellow and grassy coating, slippery and rapid pulse. Okay, though then differentiation of the flame becoming clouded, the heart orifice and the flame fire harassing the heart. Okay, this differentiation, flame becoming clouded the heart orifice and flame fire harassing the heart. Okay, so there are the two patterns are there. That nature of the pattern, two nature. Okay, one is the yin and second is the yang. Okay, what is the yin? So the flame clouding the heart orifice, flame misting the heart orifice. So that is the yin pattern, and the flame fire harassing the heart. That is the yang patterns. Okay. So similar symptoms, yin and yang, both. That is the mental disorder together by a flame patterns. And different symptoms in category, that is the clouding of consciousness. Clouding of consciousness, and patient is not interested in any. Okay, patient is not interested in anything, and there will be depression, there will be dementia. Dementia means it is the forgetfulness. Okay, dementia, there will be dementia, etc. Or without, it is the heat patterns. Okay, and in case of young, so there will be mania, then delirium, then violent behaviors, then reddish complexion, then fever, etc. With an clearly dry heat pattern. This is the clearly dry heat pattern. It is the young pattern. It is the clearly dry heat pattern. So let us summarize again. Okay, flame, heat, harassing the heart. So what is the etiology? What is the start of the problem? So excessive consumption of the flame forming foods, severe emotional problems, and invention of the exterior heat. That is the starter. Okay, this is the starter of this pattern. Okay, excessive consumption of the flame forming food, severe emotional problems, and invention of the exterior heat. And that underlying pathology, that is the spleen chi deficiency. It's cause this, if this etiology is occurs, so this pattern will be there: spleen chi deficiency, dampness and phlegm, heart chi deficiency and heart blood deficiency. Okay, and what are the symptoms and sign? It is a mental restlessness, bitter taste, palpitation, thirst, okay, red face, tightness in the chest, dark urine, okay, and expectoration of the flame, rattling in throat, insomnia, vivid dreams and agitations and confusion, incoherent speech, rash behavior, uncontrollable laughter or crying, and depression, manic behaviors. And if you see the pulse will be full, rapid, and slippery. And tongue will be red body with the deep midline crack on the tip and yellow sticky coating. So that tongue tip may be redder, dark redder and swollen. And treatment principle, so it is the, you can drain the heart fire and calm the shame, transform flame and open the heart orifice. And these are the acupuncture points you can use, okay, as per symptoms. Okay, so pericardium 5, let us see the location of the points one by one. Our first point is the pericardium 5. Pericardium 5. This is the pericardium 5. Is the three chun proximal from the wrist crease, from the pericardium 7, 3 chun. Okay, points location on the flexor aspect of the forearm, 3 chun proximal from the pericardium 7 between the tendons of the palmaris longus and the flexor carpi radialis. Okay, this is the pericardium 5. So please see the video how you can locate the pericardium 5. Okay, friends, these points, why we should use this point? So this point is resolve flame from heart. Okay, if the Flame accumulate in the heart. Okay, if you use this point pericardium 5, it's resolve the flame from the heart. Okay, so our next point, heartache. Heartache. Okay, this clear heart fire, very important point to treat the heart fire. It's clear heart fire, heartache. Okay, this is the location of the heart 8. So on the palm, in the depression between the fourth and fifth metacarpal bones, where the tip of the little finger rests when the fist is made. जब आप अपनी मुट्ठी बंद करेंगे और जहां आपका लिटिल फिंगर टच होता है, हाँ, वहां ये पॉइंट है, हार्ट एट. ओके, सो सी द वीडियो लोकेशन, हार्ट एट. Okay, this point, clear heart fire. Now our next point is the pericardium 7. See, on the wrist crease. Okay, this point specifies shade and clear heart fire. This point specifies shade and clear heart fire. Okay, what is the location? See the diagram on the wrist crease. This point is the at the wrist joint between the tendons of the palmaris longus and the flexor carpi radialis, level with the heart 7, at the same level of the heart 7. Okay, see the video location of this point. Okay, our next point is the bladder 15. This is the back shoe point of the heart, bladder 15. Bladder 15. So this point used for the clear the heart fire. So this is the back as a back shoe point of the heart. It's clear the heart fire. Okay. So this is the point on the back side, at the level of the spine. Okay. Location 1.5 June lateral to the lower border of the spinous process of the fifth thoracic vertebra. When you start thoracic vertebra, count five thoracic vertebra: 1, 2, 3, 4, and 5. It is the spinous process of the fifth thoracic vertebra. Bladder 15. Okay, let us move to other point. It is the stomach 40. Very important point for remove the phlegm. So it is the this point resolve phlegm. Very famous point for resolve the phlegm. Stomach 40. So this is on the lower leg, on the dorsal side, stomach 40. Okay. It is the 8th June from the prominence of the lateral malleolus. 8th June proximal from the prominence of the lateral malleolus. See the proper location. On the lower leg, midway between the tibio-femoral joint line and level at the popliteal crease. Okay, it is a level of the popliteal crease and the lateral malleolus. Two finger breadth lateral from the anterior crest of the tibia. Okay, palpate the tibia bone and come lateral two finger. Okay, this is the stomach 40. See the video location, how we can. Okay, this was about the ST40, stomach 40. Don't forget this point. Our next point is the liver 2. Liver 2. See this this point, liver 2. It is the on the dorsum of the foot between the first and second toes. First and second toes, 0.5 June, half June, proximal to the margin of the wave. This is okay. Find the margin of the wave and go half June proximal. See the video location. Our next point is GB 15, gallbladder 15. Okay, gallbladder 15. At the see this gallbladder 15, this red mark, red point, gallbladder 15. Okay, on the forehead, directly above the GB 14. Okay, that is the half tune within the anterior hairline. Okay, locate the anterior hairline, and go half tune up from the hairline. Okay, midway between the DU24 and ST8. Okay, DU24. You locate the DU24 and ST8. It is the midway between the DU24 and ST8. Okay, see the location of the gallbladder 15. Okay, our next point is heart 7. Next point is heart 7. Okay, this is the location of the heart 7 at the wrist crease. Okay, it is the medial level of the wrist crease. See this location. Okay, at the wrist joint on the radial side of the flexor carpi ulnaris. It is okay. Flexor carpi ulnaris. Go to the radial side of the flexor carpi ulnaris in the depression at the proximal border of the Philippons bone. Okay, so see the palpate the Philippons bone. It is the proximal border. See the proximal border of the pisiform bone. Okay, this is the heart 7. Okay, so see the location, video location. Okay. Our next point is the heart 9. Heart 9. Okay. This is the heart 9 at the medial Okay, on the dorsal aspect of the little finger at the junction of the lines drawn along the radial border of the nail and the base of the nail. Approximately zero point 0.1 chun from the corner of the nail. This is the heart 9. See the video location. Our next point is REN 15. CV 15, consumption vessel, REN 15. This is the point of the Leo connecting point of consumption vessels. This is the Leo connecting point. It transfer energy. Okay, it transfer energy from one meridian to other meridian. That the character of the Leo connecting point. Okay, so this point does specify the Shen. Okay, so this is the REN 17. Sorry, REN 15 point. REN 15. And location on the midline of the abdomen. Take the midline of the abdomen and 7 chun above the umbilicus and 1 chun below the level of the sternocostal angle. Okay, count the 7 chun from the umbilicus in the center line. See the location. Okay, our next point is the REN 12, CV 12. See, this is the 4 chun from above the umbilicus and on the center line. Okay, on the midline of the abdomen, 4 chun above the umbilicus and midway between the umbilicus and the sternocostal angle. It is the midway, umbilicus and sternum bone. Okay, so see the, this is a picture. See image of the REN 12 and see the video location. Okay, our next point is the SP6, spleen 6. Okay, on the medial side of the lower leg, 3 chun proximal to the prominence of the medial malleolus in the depression close to the medial crest of the tibia. Okay, 3 chun, fourth finger. Okay, count the four finger, not yours, patient's fourth finger from the tip of the medial malleolus. This is the SPC. See the video location. So this is the contraindication in the pregnancy. Don't use point in the pregnancy. Abortion is the 100%. Don't use point in pregnancy. And our next point is the DU20. GV20, governing vessels. DU20. This is the DU20. Okay. So this point is the 7 chun posterior from the anterior hairline and 5 chun anterior from the posterior hairline. Okay, at the level, at the vertex on the midline in the depression, 5 chun posterior to the anterior hairline and 7 chun superior to the posterior hairline. Okay, this point may also be measured at the 8 chun posterior from the glabella. Okay, glabella. Okay, that is the midpoint of the eyebrow, two eyebrow, glabella. And 6 chun posterior to the external occiput protuberance. See the video location. Okay, so let us repeat which point we should use to flame heat harassing the heart. Okay, so pericardium 5, It's resolve the flame and flame from the heart. Heart 8, it's clear heart fire. Pericardium 7, it specify the shame and clear heart fire. And bladder 15, it's clear heart fire. ST40, it's resolve the flame. And liver 2, it's subdue fire. Gallbladder 15, it specify the shame. And heart 7, it's a clear heat and calm the shame. Heart 9, it's clear heart and opens orifice. And Shen Ren 15, it is the specify the Shen. Ren 12, it is the supplement spleen chi. Supplement spleen chi. And spleen 6, it is the resolve flame and calm Shen. And Du20, it is the restore consciousness. That cloudy mind, it's restore consciousness. Take the screenshot of this page, okay? So you need not write these points. Take the screenshot. Okay, हो गया, ले लिया screenshot. Take the screenshot very fast. Okay, so how you like this session? Who will review? कौन बात करेगा ये सेशन के बारे में? आपने क्या क्या समझा? व्हाट यू अंडरस्टैंड? So I am going to unmute all and come on, unmute yourself and speak about the session, what you understand. सोनिया जी बोलिए. सोनिया जी अनम्यूट कीजिए खुद को, बोलिए. Not able to unmute. 1 minute. हाँ अभी कीजिए मैडम. हाँ बोलिए मैडम.
मुझे बोल रही हैं सर.
हाँ हाँ वेरी गुड, बोलिए.
Sir, today's topic is mental disorder, phlegm fire harassing the heart. Concept is combination of heat plus fire on heart harassing mind and mental disorders. Clinical manifestation is many things, notably fever, mental restlessness, reddish complexion, red eye, thirst, coarse breathing, constipation, yellow, red eyes, etc. Tongue is red, yellow, and greasy coating. Pulse is slippery and rapid. Analysis is caused by severe emotional irritation that is due to stasis of key, pathogenic heat resulting in phlegm fire harassing the heart, obstructing the heart by phlegm. Main symptoms are mental disorder, red tongue, yellow and greasy coating of the tongue, manifestation of internal phlegm, pulse is slippery and rapid.
Very good. And discuss the point and what
Yes,
are
sir.
the discuss all points which I
Acupuncture treatment points are P5, which resolves phlegm from heart. H8 clears heart fire. P7 pacifies Shen, clears heart fire. Bladder 15 clears heart fire. ST40 is phlegm, resolves the phlegm. Liver 2 subdues fire. Gallbladder 15 pacifies Shen. H7 clears heat and calms the Shen. H9 clears heart, opens orifices. Ren 15 pacifies the Shen. Ren 12 supplementary spleen key. Spleen 6 resolves phlegm and calms Shen. DU20 is consciousness. All this should be needle with discharge.
yes, very good. Okay, anyone asked to any queries? किसको और कुछ क्यूरी है, कुछ समझा नहीं है?
Sir, yesterday's recording.
हाँ, yesterday's recording दिया आप मेरे are you on my app?
Yes, sir.
I I given that recording and PPT also, PDF also in the app
Okay, okay, sir.
on the in the free material.
Oh. But
हाँ,
actually, in the YouTube and in the group recording, it is not coming, sir. For that only I asked.
no, you will get that recording in the my app, na?
In the app, I'm getting, but not in YouTube or this thing,
No,
sir.
no,
App.
I not uploaded in the YouTube. That
Oh,
recording will be available in the my app.
okay, okay, sir. Saspandan.
Saspandan, yeah, yeah.
Okay, sir. Okay, sir. Thank you, sir.
Okay, okay. Thank you very much. Okay, enough for today. Closing the session.